Diabetes is a metabolic disease clinically known as diabetes mellitus. Someone with diabetes has high blood glucose due to an insulin malfunction. Either their body isn't producing enough insulin, their body isn't responding to insulin, or in some cases, a combination of the two. Insulin, a hormone created in the pancreas, is needed in order for cells to take in sugar. When food is consumed, the pancreas releases insulin due to the sugar concentration in the blood, and the insulin attaches to a receptor on the outside of the cell. The receptor then signals the nucleus, which then signals GLUC4 to migrate from the center towards the outside of the cell. GLUC4 then acts as a passageway for glucose to enter the cell through facilitated diffusion. Once the blood concentration is at equilibrium between the outside and inside of the cell, the insulin is released from the cell. Glucose is the energy and fuel source for cells. Therefore, without insulin, cells would not be able to produce ATP. For this reason, diabetes can become a fatal disease if not monitored and controlled. The effects of hyperglycemia, or high blood sugar, when not controlled, include blindness, blood vessel damage, and neuropathy. Other long-term effects of diabetes include slow movements of the stomach and intestines due to nerve damage, strokes, ulcers, cardiovascular disease, erectile dysfunction, kidney disease, and periodontal disease. Luckily, modern-day technology has many helpful ways to get insulin and other drugs, like medications for dyslipidemia, hypertension, antiplatelet therapy, and glycemic control to help with the side effects of diabetes. The two types of diabetes are as follows: type 1, insulin deficient, and type 2, insulin resistant. Type 1 diabetes, also known as juvenile or insulin-dependent diabetes, is an inherited disease. Only 0.3% of Americans, or 10% of people with diabetes, suffer from juvenile diabetes. Type 1 diabetes is due to the body not producing enough insulin, and therefore cells cannot bring in sugar. The major cause of type 1 diabetes is due to autoaggressive T cells destroying the insulin-producing beta cells. When there is a high amount of sugar in the blood, the excess sugar attaches to proteins of blood vessels and alter their normal structure and function. This leads to the arteries becoming thicker and less elastic, which in turn makes it harder for blood to flow through. With a reduction of blood flow, the body, especially the lower extremities and the head, will receive less oxygen and cause damage to organs. The symptoms of type 1 diabetes include frequent urination, unusual thirst and hunger, unusual weight loss, and extreme fatigue and irritability. Type 1 diabetes cannot be prevented or cured, but must be controlled. There are 5 steps needed to take control of type 1 diabetes, and they include becoming informed on the disease, exercise, insulin injections, glucose testing, and having a managed diet. Insulin therapy is very important for people with type 1 diabetes because it gives their body the insulin it isn't making so cells can take in sugar from the blood. Modern day technology gives the option of taking in insulin through a syringe, pump, or pen. If someone is careful and takes care of their disease by keeping a healthy diet, exercising, and staying updated on their glucose levels, they can live a better quality life because they will have less side effects. We asked a few questions to someone with type 1 diabetes about how they live their life and how they manage their diabetes.
It means that one has to be more organized, mainly with food, exercise, and your medicine. Controlling your insulin constantly, eating at the right time, not abusing foods that are not needed, and exercising. Doesn't really affect my relationships because diagnosed or not, one should still take care of their eating habits and actions. I don't like sharing it out for the world to know because I don't want them to treat me any differently. But the whole family knows. Diabetics should definitely take more care of themselves, but even if you're organized, problems can be present. But the more you take care of yourself, the more years one will live. Good hygiene, good circulation is a huge factor for staying healthy when you have diabetes. Everyone has to take care of everything they do to their body and really watch out for what they do to stay healthy. Well, now with 26 years of taking care of diabetes, the only thing that really scares me is to go under surgery. If it can be prevented, it's better. I wish they knew the complications that come from diabetes and how it is possible to prevent them if you control them.
The other type of diabetes, type 2, also cannot be cured, but is much more manageable. It can be controlled because it is more of a lifestyle disease, but it also depends on how progressed the disease is. It also can be prevented through a healthy lifestyle. Type 2 diabetes, also known as non-insulin dependent diabetes, accounts for 90% of diabetic cases and occurs when the cells cannot respond to the insulin being produced by the body or the body is not producing enough insulin. Anyone can get type 2 diabetes, but people at greatest risk are those over age 45, obese or overweight, people who do not exercise regularly, men with low testosterone, those with a lot of belly fat or history of diabetes in the family, and people of Middle Eastern, African, or South Asian backgrounds. The symptoms of type 2 diabetes include increased thirst and hunger, mouth dryness, nausea and vomiting, frequent urination, fatigue, blurred vision, numbness of hands and feet, frequent infections of skin, urinary tract, or vagina, and sores that heal slowly. If not treated or controlled, type 2 diabetes, a progressive disease, can continue to worsen and can eventually lead to the need to take insulin injections, much like type 1 diabetes. Luckily, a good quality of life can still be achieved through dedication to managing their disease. This means someone with type 2 diabetes must lose weight, follow a healthy diet, exercise regularly, and monitor their blood glucose levels. Diabetes affects 25.8 million people of all ages and 8.3% of the U.S. population. If you or someone you know is diagnosed with diabetes, remember that you can still achieve a high quality of life through precautions to manage your disease.
Created using Powtoon.